Hi everyone, welcome to video number 3 about the kidney. I'm going to just share my screen here and we can get started. And I need to be able to press play here. There we go. Welcome to the kidneys. Anyway, so the kidneys. Really, when I think of the kidneys, I think of them being in a relationship with the liver, where the liver is the primary metabolizer and the kidney is the filter of those end products. To me, their team, I liken them to Batman and Robin. They just work together. You know, the kidneys do some metabolic stuff. They have a role in producing erythropoietin. They help control blood pressure, etc. And they obviously keep our pH of our blood and our electrolytes in balance in the blood and our minerals in balance as well. So they have a lot of roles and they're very, very important. But if it weren't for them having a nice way to excrete toxins and toxic metabolites, we would be in trouble. I like to also think of them as the throne for the adrenals. We're going to talk a bit about the adrenals at the end of this lecture, but you can see they're like little gnome hats on top of the kidneys there. So the one thing that I think is really challenging about kidneys is that they have a very unique anatomy. Not only are they essential to effective detoxification, but they can have a large effect on the biochemistry, but they can also have a very large effect on the mechanics. And this is the piece we often don't learn about in school. The other thing that we see with the kidneys is that they are very dense organs and they can hold very dense emotions. Again, I do not like to be too prescribey about emotions in the kidney. I think that's something where you have to take the time and ask the tone and connect with the tone of what's going on there to get a read on what might be going on with the kidneys from an emotional perspective. So here are some indicators to consider looking at the kidneys. When they're not working great, there is less urine, it's less yellow. One of the key things to look at is the distal extremities can be really itchy with absolutely no rash. That's actually not a good sign when that happens because you're getting closer to needing dialysis, etc. Kidney disease is a very silent disease, as some of you may have noticed with some of your clients, those people going through it, there's not really a lot of symptoms until things are really bad. So we might see that their eyes look hollow, gray, or swollen. The kidneys themselves can feel quite boggy and intense as though stuff is caught in that filter. And they can actually become very constrained by emotions and very heavy with emotions as well. So when the kidneys are off, we're going to notice that the body fluids in general feel like they're struggling. This can also look like heavy lymph, etc. as well. We may see that the legs, because they're inferior, are just a little bit more swollen than other areas of the body. Some people will report trouble with their energy levels. In Chinese medicine, they talk a lot about kidneys being related to qi. And so there's a lot there that I feel like you could even add to your understanding about kidneys from an Eastern medicine perspective as well. So the other thing about the energy, when people report poor energy, it might be low or just really inconsistent. Like they can't rely on it. And so sometimes they'll have energy, sometimes they won't. Kidneys also, as you know, produce erythropoietin. And so whenever there's anemia, also think about kidney physiology as well. The other area of physiology that the kidneys participate in a lot is the blood pressure. So when blood pressure is high, also think of the kidneys. You might see symptoms like headaches, dizziness, fatigue, low exercise tolerance, nausea, loss of consciousness, confusion, tightness or pressure in the chest or the arms when blood pressure is going wrong in the body. So just be as you go through here, we're going to give you a little bit more information about the kidneys anatomically so that you have a better idea of where to look for them and when to consider them. So we're going to try and and teach you not only where the kidneys are, but also look at how they're actually connected to the renal arteries and then into the aorta. And we also want to consider their tone. And then also from the kidneys, we have the ureters that come down and they stay actually quite posterior until they come forward near the bladder and insert in the bladder. And one of the things that we really notice, not only can the ureters be affected by stones, etc., but the ureter and bladder can also be very much irritated by increased acidity. So coming back to being able to neutralize those acids in our body using our buffer systems, our minerals, etc. So one of the osteopaths really actually became interested in kidneys because there were anecdotal reports of bone setters doing a lift on the kidney and this having an effect on other things like cystitis and hypertension. When they started to research this a little bit, they really realized that, you know, the mobility of the kidney is actually really important, more important than its position even. And so one of the things that we see is that oftentimes there are low back complaints that people come in with when they're standing or upright, and they feel relief when they're lying down. And so when that low back is irritated and people are completely relieved by lying down, this is when you actually want to also start adding kidney to your clinical reasoning and thinking about that as as possibly playing a role in that low back pain. So when we palpate the kidneys, they really sit at that TL junction. So on either side of T12, L1. Of course, the right kidney sits just a little lower because it has to navigate existing right up against the liver. So you can also see that if you have liver congestion, it's going to affect the kidneys in the sense it'll put a little bit of pressure on it and probably put a little bit of pressure on that adrenal gland as well, which we'll talk about. They're a structure that's considered retroperitoneal. Well, never has retroperitoneal been more important to you than in this class. We are going to talk about what it means to be retroperitoneal quite a bit. But basically, the kidneys sit behind all of those structures contained within the peritoneum. And so they're not really part of that abdominal cavity. They butt right up against the musculature of the low back. And so they're kind of in that place that's in between the abdominal cavity and the actual musculoskeletal system. So if we were to palpate them from behind, you're going to find that they're probably on the average person, by the time you get underneath that musculoskeletal layer, they're going to be about 8 centimeters deep. So they're quite deep. And then from the anterior aspect, if you were to palpate for them, they're going to be about 1.5 centimeters of muscle tissue first, and then about 10 centimeters of visceral tissue, again, depending on the person and them having an average body size. So the other thing that's really interesting is that kidneys are actually surrounded by fat. Now, depending on the amount of visceral fat that is found in a person, that may vary. Some people actually, I've seen cadavers where there is no fat around the kidneys, so they've lost all of that fat. But the body, when it adds adiposity into the visceral layers, it actually adds it into those in between those layers that are actually the suspensory elements for the organs. And so there's like a pocket of fat that generally the kidneys will sit in. A little bit of visceral fat's actually healthy. And when there's more and more visceral fat, it actually really squeezes those kidneys. So that's something that you want to consider depending on the level of visceral fat in the person on the table. So they are also surrounded by a fascia that wraps all the way around, and we'll get into the details of that. And they have renal vessels, of course, that go into the aorta and the inferior vena cava. And that's actually a really strong suspensory element there. Arteries are really quite strong structures. They have to stay open, etc. And so there's actually a really and actually there's fascial elements that connect them too, which we'll discuss a little bit more in the anatomy. And as much as they're on either side of the spine, there's a sense of connection between the two organs. So when one is struggling with mobility, it will actually have an impact on the other one as well. So it's really kind of interesting when you see one improve, you often see it bring the other one along a little ways as well with that improvement. So on average, they're about 12 centimeters long, 7 centimeters wide, and just 3 centimeters deep. So they're not that thick, probably just over an inch there, and a few inches long and a few inches wide. So the left one is also slightly larger than the right one. And again, that right one is also about 1.5 centimeters lower. So the renal fascia. So this is a really interesting little bit about anatomy. And one of the things that we understand is that the fascia comes down and envelops the kidney. So say we're looking at it from a lateral aspect, envelops the kidney like this. So we have an anterior layer and a posterior layer as well. So obviously they meet at the sides, etc. But that is actually the renal fascia. So the posterior renal fascia, the posterior lamina, covers the quadratus lumborum and the psoas, but it also attaches to the anterolateral aspect of the vertebral column. So, really quite deep in there in those vertebral bodies near those. And then it also attaches all the way up to the diaphragm, and we're going to go over some pictures about that. The pararenal adipose is like a cushion that helps hold them in place. This is a really great picture looking at the renal fascia. So you can see the kidneys on either side. I'm going to see if my pointer will show up. Oh, no, it won't. So the right kidney and the left kidney both have that anterior and posterior fascia. You can see it wrapping around all the way to the lateral aspects. This isn't a great picture showing that same fascia being continuous to in front of the vertebra and in front of those vessels there. It actually invests those vessels as well. So you can kind of see the posterior lamina coming into the fascia around the vertebra. So there's a lot of fascia there holding it in place, but that you can also see that there's a really big relationship to the actual vessels that come in and out of the kidneys. Another thing I really want you to notice in this picture is the liver. So the right kidney actually abuts up in along the bare area of the liver. And you can also see that it's fascially connected to the large intestine on both sides. So that fascial connection is actually called Tolt's fascia. So in previous lectures, we've talked about how we can have with the liver, an extrahepatic tension that can be pulling on the liver. And so the kidneys actually can be pulled around by so many things, even though they are retroperitoneal, those structures within the peritoneum and in the abdominal cavity. If there's tension being held in them, they can really pull on the kidneys as well. So this is really tricky to discern all of this, but you guys have some great palpation skills, so I'm pretty confident you'll be able to get there. This is a lateral view of the liver, kidney, and large intestine. And so this is, of course, on the right side of the body, but you can really clearly see that posterior renal fascia coming down from the liver, the anterior renal fascia as well. And you can see the actual adrenal gland within that, held within that. And you can see how you go up into the bare area of the liver, and then the kidney actually connects with the adrenal gland there up into the bare area of the liver, and you can see the peritoneum coming up and turning around to allow as it doesn't go up and around over the bare area of the liver. And then we also have our right colic flexure here, and you can see it hangs off of the kidney here, and you can see the nice perirenal fat pocket that this kidney is in. And we're going to talk a little bit about that. But as you notice, as you go inferiorly, that posterior and anterior renal fascia actually don't seem to connect. Like there's not really a way that they connect. So that's an important piece of anatomy there. So that renal fascia, we know that the posterior peritoneal wall covers both kidneys and forms the anterior renal fascia or lamina in this, depending on which book you're looking at. It fuses in front of the vertebra and in front of the large paravertebral vessels. And that's how the kidneys can be connected structures and influence each other directly, even though they're on other sides of the body. And so we're going to see that tensions that affect one kidney also have an impact on the other. So this anterior layer is not as thick, but it is reinforced in certain places where it is in contact with the colon, as we talked about, and that is called Tolt's fascial layer, if you want to have a fancy name for that. There are lymphatic vessels there, and it's really that junction between the visceral and parietal peritoneum as well. So the posterior and anterior lamina, as we saw in this picture here, they do not come together inferiorly. And this is actually really important because this allows the kidneys to drop down, and that is called ptosis. And so because of this feature of anatomy, this is something that is a risk for the kidneys. They can drop down, and we'll talk about the consequences of that as we go along, because it is quite problematic. So this picture from Netter I thought was a really great one because you can see the posterior lamina in front of the vertebra there and actually overlying your sympathetic chain, etc., and going over to the other side. So it's one continuous piece of fascia going around there. And then you can also see the anterior lamina going around and wrapping around the vessels that sit just in front of the spine. You can also see other structures there, the colon as well in this slice as well, and you can see how tensions held there could be affecting the kidneys. And then also you see a little slice of the pancreas there anteriorly. It's really actually kind of useful to really study your slices and know where you are. So in this case here, the vertebral level is L2. And yeah, anyway, and we're starting to deal with the cauda equina here rather than the spinal cord. This is another great picture from Netter. It's probably one of my favorites that really demonstrates how other structures can be pulling on the kidneys. So on the right side, we can see that the liver has been cut away, and the area that was the bare area of the liver is not covered in fascia. And you can see the right kidney butting up against the liver in that area. You can see how it would touch the liver without that layer of peritoneum there. And then as you go down, you can see that, oh, wow, it's really connected to the duodenum as well and the large intestine. And then you have the transverse colon slicing across and going all the way to the other kidneys. So another way that colon tension could be impacting the kidneys in terms of being paired structures, being very much influenced by tensions held in other structures. And then you can see on the left side again how the left colon would be attaching to the lateral aspect of that left kidney and then coming down all the way to the rectum. So these pictures are really great pictures to take a look at this. You can kind of get a sense too of that fascial layer that you can really see creating a bridge between the right and the left side as well. Kidney mobility. So again, we're not talking motility, we're talking mobility. So this is really how well the kidney moves in situ. And one of the ways we're going to test this, and please maybe leave this till we're together. Testing mobility of the kidney can be quite painful in individuals if there's any sort of digestive inflammation or anything like that. These are very deep structures, so you do have to apply quite a bit of pressure to get to them. And there's a way to kind of minimize how intense that is. And so I really want to be able to be there hands-on with you and talking you through this and demonstrating it for you. So this is more for your awareness. When we inhale, the kidneys push down and they follow the rail of the psoas. So they're right up against that musculoskeletal system there. And so when you inhale, you're going to see that the top of the kidney actually bend forward, externally rotate, and move inferiorly. So we want to be able to see that that's actually happening. It's not good if you have a kidney that's frozen. You really kind of need to figure out why. If a kidney is really frozen, just think of how the muscles feel being up against it. They're also going to be somewhat frozen as well. And there's going to be just that slide and glide of those tissues is missing. And so there can be many reasons the kidney that is frozen. It could have to do with its own support systems, but it could also have to do with a lot of other things. And so learning to discern where you need to go to improve kidney mobility is definitely a skill. So when we do this exercise, we'll cover the rest of this slide then. But just to be aware of the fact that if you're even palpating lightly, you can start to feel for kidney mobility with inhalation. So you can have people take a deep breath and see if you can detect this motion as well. But we are going to take the time to try and somewhat catch the kidneys in our hands in class, and so that you have a really good sense of where they are and what they feel like in the tissue and just how dense they are. So this is the anterior view of the kidneys. Now, a lot of those fascial elements are cut away, but this is just another really great view of the kidneys, and you can see the relationship to the adrenal glands a little bit better here. You can see them clearly. One of the things you can see is just how much blood is going to the adrenal glands. You can see that on the left side better than you can the right. You can see their relationship to some of the muscles and how they're right along the psoas there. And so that's why they can be really influenced by the psoas in terms of how they're moving. And so there's that. And now here's a posterior view. So this is our view in terms of what we're probably more familiar with as chiropractors. You can see that inferior pole of the kidney comes down to about the vertebral level 3, 4, probably 3 more than anything, somewhere in that neighborhood. And there's a nice little space there underneath it that we'll learn to find so that we can catch the kidney and check its mobility. On the right, you can see again that the kidney is just a little bit lower. It doesn't quite go up to rib 11. And it's just a little bit higher there on the left. You can see that they've drawn a little outline of where to expect to find it. And you can also see here that it's right along, sitting right in front of the quadratus lumborum. So one of the things too that is good to know is that the kidney is very much in relationship with the pancreas. And the pancreas is a really amorphous, delicate organ. It really does not look like this on dissection. This nice netter picture of it is just very inaccurate. It almost just looks like a web of like tissue. It doesn't make sense in the way that it does in this picture. And so it's very, very delicate. So you want to be careful when you're working with the kidneys, especially that left kidney, that you could actually be pulling a little bit too much on the pancreas. And we want to just make sure that we respect the fragility of the pancreas there. And it basically make sure you stay inferior of it. Don't try to go hiking up towards the top of the pole of that kidney at all. So kidney motility. Now, kidney motility there is a basic motility that you will find, and so there is an instance where it can change, which we will discuss a little later. But in motility, unlike mobility, there is no forward bend. So we're not going to see the kidney move forward. So when we're just listening for that very subtle craniosacral-like motion of the kidneys, we're going to find that the kidney, of course, can move inferior, externally rotate, and then at the very end, it's like it just goes out a little bit. It just moves out a little laterally. So we're going to see down, external rotation, and out a little bit. So it's a very, very subtle, slow motion. When you're palpating for it, usually I like to put the heel of my hand around umbilicus, and knowing that I'm going to find it a little lower on the right and a little higher on the left. And I let my awareness drop into the cavity and then let that motility come into my hands. So this is actually a really great thing to start practicing before we get together to see if you can find kidney motility on the people in your table. So if you have a few extra minutes and you want to just listen to a kidney, go for it. That would be actually a very useful thing to do. But we will go over this together when we get together in class. So ptosis. Now, there are considered to be 3 degrees of ptosis, and this is actually kind of important, especially like 1 and 2 are going to present somewhat similarly in terms of motility, but 3 is going to present very differently. So one of the reasons we can see ptosis, of course, because we have that situation where the fascia around the kidney does not actually come together fully. It actually just barely meets, and we have that ability for that kidney to drop. There's many things that can cause that drop. One of which is, of course, trauma, where we have a downward fall, and that just really bumps things down, and it's enough force that the kidneys are able to drop. Again, because the kidneys are such heavy, dense organs, kind of like the liver, even denser than the liver, really, they are going to experience forces in a bigger way than even other tissues. So between this fact that it doesn't really have an inferior fascia stopping it from going further south, really, actually, one of the main things that's stopping it from going further south is its connection arterially to the aorta. And so it has this ability to actually drop. So trauma is a big source of, a big reason this can happen. Weight loss is actually another reason. Again, those kidneys are held by a fat pad. And so when we lose that fat pad, they can actually just droop and drop. They're used to having that fat there. It's really interesting when you do dissection on somebody with a little more visceral fat. You take the kidney out and there's this like little pocket. It's in this like little cushion that's really like concave for it. The body makes space for it and loads the fat in places where it can fit the fat, but then that fat becomes a nice little concave area that holds the kidney. So when you lose that fat, the kidneys can ptose. Childbirth, of course. For starters, we know that the ligaments become a little laxer. We're dealing with a lot more weight and load and postural strain in this area of the body. One of the things I always find is that's also an area that during pregnancy, it's going to load with tension, look like there's not continuity, but I have learned, do not try to bother trying to establish continuity here when they're posturally engaged. It's really I feel like that actually is just really useful for bracing them from gravity, etc. But it's also right around the kidneys. So, that's something to consider as well. And then also just birthing children, there's a lot of force and a lot of bearing down, and that can cause kidney ptosis as well. So one of the things that's a little bit different is when we have 3rd-degree ptosis. Now in this picture, they show ptosis, and they've got one kidney there where the top of the kidney is just, right above rib 11, close to T11 there. And you can see that that's, like just drop down a little bit. It's not quite up at rib 10. And then, so that would be stage 1. And then we've got stage 2 dropping now down below that rib. And then 3rd-degree ptosis, we're down around 12th rib instead of being up just under rib 11 and rib 10. So we want to make sure that, and what's tricky is that this will be different side to side. They're going to be different. And so in 3rd-degree ptosis, when it comes down far enough, that kidney, instead of going down, externally rotate, and then out laterally a little bit, it's actually going to come down and then come into that rail of the psoas. So it's actually going to come down and continue in instead of having that little bit of flare laterally when you check motility. So things are bad when your motility is looking a little bit different. You've got 3rd-degree ptosis there. So this is more common on the right, and I really think this is anatomical because we also see that the right kidney sits a little bit lower, so it's going to be affected by the psoas structure more than it would earlier than it would be on the left as well. So another thing that we're going to see also too is sometimes when this happens, maybe an increase in a history of UTIs or frequent UTIs. We may also see whatever their symptoms are, we're going to see that increase with prolonged standing when there's ptosis as well. And then the other thing is that we can see more low back pain and sciatica. Just everything gets a little bit more loaded. And we're going to talk a little bit about the lumbar plexus and the kidney because there's a strong relationship there. Those nerves do not go down and form part of the sciatic nerve, but there is definitely a load on the whole system because of it. The other thing we're going to see when there's kidney ptosis is occipital restrictions that don't resolve. I think all of us have probably had situations in practice where we're a little bit frustrated by things. We've adjusted them, they feel good, and then the person comes back and they're still there. To me, that's a reason to treasure hunt. I want to know why something's not actually resolving or being very stubborn. And so this can be another thing that you can consider when you see that. Now, this is an extreme picture of ptosis of the kidneys. And I don't think it's ideal because I think the position's wrong, etc. But I just thought I would throw this picture in for effect. Anyway, so let's talk a little bit about BGI and the kidneys and the geometry. So, of course, when we look at the posterior geometry, the kidneys are really actually mainly in that base area of the lumbar tetrahedron. And I think all of you who are attending this class probably know what a tetrahedron is at this point in time, but if not, then the lumbar triangle. And again, as the kidneys pitose, what happens is the geometry of that area actually narrows. So it actually makes a lot of sense that instead of flaring out, they come to a point where they start to flare in and as they pitose as well. And then, kidneys, of course, are really situated in that area that's a base, which makes a lot of sense in terms of the density of the tissue, the structural nature of the kidneys in terms of how they relate to structure. They also are in a relationship with the base of the umbilical tetrahedron when you look at how those structures are connecting through the peritoneum and attaching to the kidneys as well. Yeah, so there we go. And coronal motion in the kidney. Now, this is a little bit different because the coronals are situated in a transition zone for coronal motion. So their motility to me is very much keeping in within that sense of rock that you have within the coronal planes, a sense of, we talk about it as kind of a strict A to P, but these are kind of like doing this kind of thing. And I feel like they're a bit of a handle directly into the coronal plane, especially medial coronal planes when you get really medial with those. The other thing to consider is that when we want to work fractally and we want to look at paired structures and working with paired structures as a handle into the whole system, the kidneys are a really great avenue to work with that. There's a lot of there's a lot of connection through the fascial structures to everything else. So you can really see how they could be used very powerfully as a self-similar structure. So one of the things that I want you to do before you hit class, we're not going to worry so much about mobility, but and we will repeat this exercise in class, is take the time to feel motility on various people in your practice. If you notice somebody who has low back pain that has more issues with standing and sitting and being upright, and they're fine when they lie down, so definitely start taking a look at all of this. And we will worry about the rest of the exercises then. Whiplash and trauma, they can actually not only cause some ptosis, but they can cause the kidneys to feel like they're a little bit frozen. So they're not actually moving very well. You're not going to see great motility. You may not see great mobility either. When we look at toxins in the kidney, again, I think that's something that's more detailed in terms of tone, but that's, in early BGI land, we talk about bogginess or rubberiness in terms of toxins being in that area. And of course, we're always thinking about where is the greatest potential? Where is that greatest potential stored? And what is the dominant information stored in that potential? So I'm going to skip some of these here because we are going to do them together. So nerves and the kidneys. And I loved this picture from Netter because you can see the kidneys there, but it's also a picture that's more focused on the nerve structures, and you can see the lumbar plexus coming out and right in front of the kidneys there. And so as the kidneys petose or are frozen or distorted or anything like that, they will take those lumbar nerves with them. And those nerve roots form your ilioingual nerve, your iliohypogastric nerve, and your genitofemoral nerves. So obturator nerve can also be affected if there's ptosis. So this is just a concept to just keep in mind as you're working with it as well. So things that have been typically found to be associated restrictions with regards to the kidneys. So of course, T12 and L1, so that thoracolumbar junction. Of course, T10 to L1 also. So really in those bases, when you're considering the posterior geometry or even the anterior geometry because of that umbilical geometry having a relationship with it. T6-7, which I find really interesting more from a coronal perspective or even an internal geometry perspective, because the fascia surrounding the kidneys goes right up into the diaphragm and connects with that as well. So in a way, that's not surprising that it could pull up into that area as well. The coccyx can be quite restricted. And to me, I understand that more from there potentially being a relationship to it from the coronal planes because of the coronal planes being just rocking, etc. And then also the internal geometry because which is actually, I'm not going to get into that can of worms, but there's a lot there and it makes a lot of sense considering the internal geometry really then goes down and has significant tensions held within the pelvic floor as well. And that would connect right into the coccyx. And then of course the occiput, it's a base. So, and it's connected to both the bases of the posterior and anterior planes, and also that can also be related to the internal geometry as well. So we're gonna skip working with the adjustment here. I did not do this with the liver, but we will do this again in class. So when it comes to the kidneys, I wish I could say this is everything that you need to know to help the kidneys from a physiological perspective. But these are just some ideas, just some ways of thinking so that if you are referring out to help people improve their kidney function, these are some things that will be helpful. But it's also a way of thinking. There's many different product lines out there. I'm more familiar with the UNDA numbers. They are from Europe. So those of you who are from Europe might find it helpful and easy to get these things. But it also is something to think about in terms of finding a practitioner to help support your client as well. Are they using things that help this kind of stuff? And are they thinking about things in the right way? And so again, of course, foods that are great for kidney, we see things like artichoke, garlic, cauliflower, apples, cabbage, cranberries, blueberries, fennel, and beets. Some of my favorite foods, to be quite honest, are great for kidneys. Another thing to consider is that it's a really good idea to sip your water rather than drinking it all at once. Just giving the body a chance to assimilate that water and slowly bring it on board rather than being a big, strong hit. So coming back to, it's a really good idea to not let yourself get too dehydrated so that you don't put yourself in a situation where you really feel like you need to drink 2 big glasses of water. UNDA 2 is a homeopathic, and I love the UNDA numbers because they often have elements in them that help potentiate the enzymes and are actually enzyme cofactors, even though it's homeopathic. There's just very, it really has this effect of potentiating the enzymes in the body. And so I really love that about the Unda numbers. And a lot of times they can be quite gentle, some of them, especially the ones that are more focused on establishing homeostasis. And then there's ones that are better for drainage. And so Unda 2 is really actually a great kidney drainer, but it also has the effect of helping establish homeostasis. And so it has a little bit of effect on the qi, like it would with Chinese medicine. So it's a nice all-round remedy for the kidneys. I've actually seen this one even pop people out of needing to go for dialysis. So it's a very powerful remedy, and it definitely improves kidney function, which is great. And Unda 44 is another type of kidney remedy. Usually this is used more for infection support or assisting in heavy metal detoxification. So if people are doing a stronger detoxification protocol, this might be a really great way to support the kidneys. Unda 45 is more specific for kidney stones, and Unda 226 is really more about improving liver, gallbladder, and kidney elimination. And Unda 258 is also for stones. It basically breaks down anything in the body anywhere. Any form of homeopathic juniperus is really great for the kidneys. This can be really great even in a history of chemotherapy, because juniperus has this effect of being a very powerful liver remedy and also a very powerful kidney remedy. So if you take too much of it after having chemotherapy, some people feel like they're doing chemotherapy again. And so it really has a strong effect of pulling those kinds of things out. So there's also a lot of herbs for kidneys. I can't say I really use these a lot. I always find with herbs, there's a little bit more risk of interaction if there's other medications on board. Also, too, a little bit more risk for an allergic reaction to occur. So Chanca Piedra is known for helping stones. Goldenrod, Uva ursi. You see that a lot in formulas that are out there off the shelf saying they'll help like a herbal detox kit. Marshmallow root, dandelion, those are all helpful for the kidneys. So we're going to talk a little bit about the adrenal glands here. And of course, there are these special little glands that sit on top of the kidneys. They look a little slouchy. They look like little gnome hats, if you ask me. And adrenal glands are incredibly important glands. And if you look at this picture and you look at blood supply, of course, the kidneys have got a good blood supply. They need to. You can see a nice artery coming off and a few branches going into the different zones of the kidney. But if you look at the adrenal gland, it's like a piano. Like there's just so many little vessels coming into the adrenal glands every way that an artery can supply it. And so it's really clear to me that the body has identified this as a very important structure. We're going to get blood to it no matter what, so it needs to get information to it. And then too, the veins are the exact same way. When you look at venous drainage of the adrenal glands, it's basically a parallel to this arterial circulation. And so adrenal glands, and I'm not going to get into all of the physiology of adrenal glands. We don't have time for that. And I'm sure you learned a whole bunch of stuff about that in school. But at the core of it, I really feel that I look at these things as our ability to heal and adapt. They're part of our HPA axis, and it is really when you have people who they're fatigued, they're tired, they're not responding to things the way that they should, etc. I think toxic overload can be one thing, but these glands can just be kind of done. We're not adapting to life the way that we should. And so we're going to talk a little bit about that as we go through working with the adrenal glands. So again, here's another beautiful picture of suprarenal circulation. You can see how many little vessels come into those adrenal glands. They're super important little glands. Obviously, your body has decided you need them. And it is very serious when somebody suffers from a condition like Addison's, where maybe you're not making cortisol anymore. This is where the bulk of our cortisol is made. Here's a nice little dissection picture of the left suprarenal gland. You can see it in relationship to the spleen there. and that artery coming off of the aorta. And then here is the right suprarenal gland. So it's really close to the inferior vena cava, but the venous drainage is honestly parallel to this arterial supply as well. So the other thing that I find really interesting, coming back to the concept of the HPA axis, is that there's a lot of autonomic fibers around the kidneys and the adrenal glands. Like there's not a lot of, I don't think there is a place in the body with so much autonomic activity and connection. So you can see that the autonomic nervous system really is doing a lot of work here. You can see the celiac plexus in this picture and the superior mesenteric ganglion. And so there's a lot of autonomic activity. So not only are we having vagal input, we're also having a lot of input, as you can see, from the sympathetic chain along the spine. And just not exactly the way the arteries do it, but very similarly, there's a lot of nerves heading to those adrenal glands, more than there is to the kidney, really, when you look at it. So again, identifying it as an organ that's essential to life. Our body really wants this organ to have an idea of what's going on. And when you look at this structurally, and if we go back to just the kidneys here and how there's a fascial element that goes behind the kidneys and then goes over top of the spine, and then it wraps around to the front and goes over top of all of these vessels. You can see that if the kidneys are really, really frozen, it's going to have an impact on this area as well. It's probably going to be affected by how frozen it is. And if there's something extra renal that's really affecting the mobility and motility of the kidneys, it's also going to have a huge autonomic impact. So one of the things about working with the autonomic nervous system is there's definitely handles that we could go over one day about working with it specifically. But the more that we improve the tone in these areas, the space in these areas, the more everything's going to be able to chat better. And there's just a lot there that we probably will never know entirely what's going on. And really, actually, having that handle into tone is probably going to be the way we're going to get the most information. There isn't really a blood test that we can do or anything like that that really tells us where to look in the autonomic nervous system in terms of helping it actually function the best that it can. So coming back to adrenals and the ability to adapt and heal. Over the years, when I first started practicing, adrenal fatigue was the thing everybody talked about. I think there's we understand so many more layers about this, everything from mitochondrial health to, there's just so much more to understand in terms of the HPA axis and how we source energy as humans and why we feel energetic or not, that kind of thing. But we do know that when there's prolonged stress, and that can be also acute as well, if it's very acute or like a chronic infection, we do see fatigue. And oftentimes people feel very blah or lackluster after a stressor. I remember pretty much every time I've had a really bad flu, it usually takes me a good month to start to feel like myself. I actually feel a little bit depressed, and I'm kind of known to be notoriously happy. And it takes a lot to really get me down. And so it was, it's always kind of hard for me to get through that month because I'm just not used to feeling like that. But I also appreciate recognizing what that feels like as well. The one in practice, what I do find is that those people with a lot of chronic stress, and maybe they can't get out of it even, like their situation is just such that I just feel like I'm helping them along, like I'm just keeping them standing. Really, that's my only goal as a chiropractor clinically, is just helping them put one foot in front of the other and wake up every day and do life, because life is that stressful for whatever reason. And what I find is that these are the people where when you adjust them, they on one hand really need the adjustment, but sometimes they don't feel so good when they get up. They might feel a little bit like dizzy or lightheaded, and they needed that change, and things are moving better, but it's almost like they just need a little more time to adapt. And that's where actually I find having an open room really nice, because you can just let them cook and let their bodies actually like have the time to take in that change and run with it, they're not going to run with it like other people do. And so this is something that when you first encounter somebody and they come into your office, sometimes it's a little bit of a, it might be a bit of a good idea to kind of just try and get a sense of where they are in that spectrum of, can they take something and run with it, or are they somebody who needs a little bit more time because their system is so depleted and those adrenals are not really there, able to adapt and heal like you would normally see in somebody's whose system is a little more vital and less stressed. A lot of times when I see that, though, I do find I can lay them back down, help reset their cranial rhythm, and then they're good to go. They feel a lot better, and often just takes a few seconds to get this done. And it's just like, it's almost like that change. They are just a little bit out of sync with their cranial rhythm. And if I put them back in sync, they're fine. And so I also know that these are people where less is more. I don't need to use huge forces necessarily. They probably won't adapt to them very well anyway. I don't necessarily need to try and change everything I find. I just really take the time to do one piece at a time, make sure it feels really complete and really clear. And that really seems to give them the most success in terms of being able to take that input and actually improve, and or even in some cases just be able to stand up and be able to take on the rest of their day and the rest of their week. So another thing to consider is that these are people who often have complaints that drag on and on. They can be very symptom focused and annoyed that things don't just heal super fast. When we see somebody with stronger adrenals, they do recover sooner. Our body does heal in the parasympathetic state, but then there's the flatlined, like kind of not even parasympathetic state anymore, where there's just not a lot going on. So we need to be in that state where we can like rest, relax, and digest. We can actually then suddenly run from the tiger if we need to, but we don't want to be in that state where it's like, yeah, we really don't have the energy to run with this from this tiger right now. That's not a good place to be, and that's not really healthy sympathetic tone either. And so as far as like addressing the adrenals, I'm not here to teach you how to do that in terms of how to assess them hormonally. I do know that there's salivary tests, et cetera, that can be done. And again, that's also something that I generally refer out for if I feel like there's a really big issue here. So adrenals and the adjustment, we're not going to cover that so much here, but there we go. We will when we get together in person. And so one of the things that I feel like is important about considering the adrenals is that it can really take about 2 years to support their healing. It can be really hard to address chronic stress in somebody's life. Unfortunately, some people, they really can't get out of the chronic stress that they're in. It's just not even possible. But hopefully there is an end in sight. I've seen people go through serious, prolonged, protracted, stressful divorces, people dealing with people in their lives who have very severe mental health issues. Like I've just seen it all. Chronic illness, et cetera. Being a caregiver is also very stressful, and people can get very depleted to the point where not only have their adrenals crash, but their thyroid crashes, et cetera. So it can really take some time to help these people recover. Sometimes in daily life, and I can't even say I'm really good at this, there is so much benefit in incorporating rest into your day. One of the things I've always found kind of interesting is that, and this is what I share with my clients, is that the Seventh-day Adventists, they're very strict about their Sabbath. And so they're that group in Loma Linda, California, where they're considered to be, it's considered to be a blue zone. So they have longevity in this group, and they're not necessarily genetically related. There's people in from different racial backgrounds involved with the Seventh-day Adventist community in this particular area in California. But they are actually very observant of their Sabbath. They really take a rest day. And I have friends who are quite observant in terms of practicing their Jewish faith, etc. And they also are very respectful about taking a true Sabbath. And, when you think about how many days that adds up to over a lifetime, it's about 10 years. And these people live about 10 years longer in Loma Linda, California. So there's something about taking that opportunity to actually be in deep rest. I think I need to do it as well. I'm not always really great with that, but I've also been learning to incorporate rest into my day and not feel guilty about it. I probably am not somebody who can be really observant of a true full day Sabbath. I find that a little bit hard for people who are moms and that kind of thing. There's always something to do, but I'm just learning more and more to take some time to rest and not feel like I have to get more done today. I can just get what I can get done. The other experience I've been having recently is after having dengue fever, definitely there's something not right about my HPA axis and there's some dysautonomia happening. And I have had to learn to just be okay with not achieving as much as I'm used to. I just have learned to just do what I need to do and poke along with it and have it work for me and not and be respectful of the fact that I actually just need rest. And I come from a family where we're not so good at that. We kind of view a change of scene is as good as a rest. You go and do something else, and that's a rest. But actually, I've actually really just needed deeper rest. And then the other thing is too, is they really need a lot of nutrition. Coming back to minerals, magnesium is probably one of the most important mineral for the adrenals. Zinc is important for the adrenals and thyroids, and iron. There's just so much going on there. You actually need all of those minerals. So making sure you're getting proper nutrition is really, really great. Things like meditation, adjustments that actually help you drop into parasympathetic, all those things that just help you drop your sympathetic tone and drop into parasympathetic are a really great thing. Of course, when it comes to the adrenals, there's a lot of great herbs and glandular supports and homeopathics, etc. There are definitely special states where you would consider certain things over another, like in pregnancy, you would look more at nutrients, rest, and maybe some homeopathics. And somebody else who's not on medication, you might look at herbs, that kind of thing, to help with the body. Unfortunately, I do find with adrenals, there are a lot of herbs like ashwagandha where you actually shouldn't combine them with something like hormonal birth control, etc. So there can be a lot of contraindications to these things. So I feel like if you're going to actually help people manage this and support their adrenals, it's good to have a lot of tools in your toolkit to work with that. And the other thing is too, is that sometimes when you're using some formulations that I feel like there's some herbs that really drive a little bit of the autoimmune process, and a lot of people out there, I feel like in our practices are actually they don't really have a full-blown autoimmune disease, but they're kind of autoimmune. You might even see an elevated ANA in their blood. And so just be mindful of how something might stimulate the immune system and who you're working with if you're going to do this. But again, too, just finding a very trusted practitioner in your area that you can refer to for that is also great. And no matter what you choose to do, go back to what you first assessed in this organ. And then as the adjusting process goes on, you're going to find it's really neat when space opens up around those adrenals. It's like they get so happy with more space. When adrenals do not have space, as you can see, it can really affect arterial circulation. It can really affect venous drainage. It can really affect how well those nerves are chatting with everything because everything is squeezed. So the more you open up that space, the better they feel. But as you also maybe employ some of these other things and these other strategies, take the time to feel how that feels under your hands and what you're noticing. And because if you're really trying to improve things with herbs and minerals and vitamins, etc., and different cofactors that can support the adrenals, and the circulation is such that it's really not getting to it very well, that's a problem as well. So yeah, definitely have fun listening to these organs as you work with them. So again, so some specifics about supporting the adrenals. There's of course homeopathics. I don't know what's available in Europe or, different areas. So I just kind of left that kind of blank. Glandulars. So Cortrex by Thorne is one of the products that I've been able to get, and it's actually a glandular of the adrenal gland. So there's lots of different herbs. In Canada, what's available to us are like MediHerb, St. Francis, Metagenics, Innate Response. There's all sorts of different formulas. I often like to test people on different formulas because there's some that just really seem to work and then others not so much. In Canada, Cytomatrix produces probably the best rhodiola that we can get here, and it's great. Just a nice, simple rhodiola can be also very helpful for supporting the adrenals. Your B vitamins, your magnesium, your zinc, your vitamin C, trace minerals, those are all great for supporting the adrenals as well. Going back to Enda 2 can help with the chi and the kidney, but it also has a mild adrenal support as well, and that's a homeopathic. A couple things you might want to look at with regards to the blood work when you're struggling when somebody's struggling with adrenals are things like their iron status, their B12 levels, their thyroid and blood sugar should be checked as well, because when I can't remember who said it off the top of my head, but in nature, when you pull on one thing, you find that it's connected to everything else. And it's very much like that in the hormone systems. Once one hormone system goes down, the others start to follow suit. That ability to maintain homeostasis starts to get really, really difficult, and the body's really struggling to try and do that. So just to be mindful of that as well. There we go. And so we're all done kidney and adrenals, and we'll see you in class to have fun playing with that. And I will try and stop my share here and stop the recording.